Hey, you've joined the Wednesday episode of the Frank Figliuzzi Show, and thanks for hanging in there. I know we're a few minutes late, but when you've got doctors coming in, you never know what their schedule's going to be like. But Dr. Vin Gupta is with us today, and the timing is still perfect for what's going on in our country right now. Let me just give you a very brief introduction because we're just thrilled to have Dr. Gupta, and we're going to spend as much time as we can with him and as his schedule permits. So you know him. If you're an MS Now watcher, you've seen him for years as a senior medical contributor. He's not only a physician, but specializes in public health and pulmonology. Boy, that was really prominent during the COVID crisis. And so many of you, when I promoted this guest today, said, he helped me keep my sanity during COVID. Multiple folks like you. That's a great thing to say. Maybe he can keep us sane for the next 45 to 50 minutes. He's also managing director of health innovation at Mannett, Phelps and Phillips, formerly a chief medical officer at a major corporation. He continues to serve as an affiliate professor with the University of Washington's Institute for Health Metrics and Evaluation. As an attending physician at Virginia Mason Medical Center, lead officer of the Critical Care Air Transport Team for the U.S. Air Force Medical Service Reserves at Joint Base Lewis McChord. And listen, if you want to know his credentials even further, let's go ahead and do some bragging. His undergrad was at Princeton. His medical school was at Columbia University. He's got a Master of Science degree from University of Cambridge. And, in his spare time, he picked up a Master's of Public Administration at Harvard Kennedy School. Obviously an underachiever and a slacker, but we're going to have him on anyway. Dr. Gupta, welcome.
Frank, thank you so much for being here, and I apologize to you and your viewers for being a few minutes late.
No worries.
I'm a huge admirer of your work, and just feel privileged.
You're very kind. You do likewise. Right back at you. You really do keep a level head, which is so crucial in both of our lines of work. We've got to keep in the middle on the truth and the facts, and that's what we both have in common. Hey, as we say in the interview business, let's start at the beginning. Everybody's talking about Cyclospora and if I pronounce it correctly, cyclosporiasis. I don't know. Help me out with that.
Cyclosporiasis. Yes, you're right.
Thank you. And so let's start at the beginning. What is Cyclospora, and how do you get it?
Sure. So, well, again, thank you for having me, and to all your viewers, trust. Cyclospora is a parasite that can be treated with antibiotics that infects the intestinal lining of human beings, and it causes a condition, cyclosporiasis, that is what we're hearing all about now across the country. There's an outbreak. I think just some context for this. This is something that we know has existed in our food supply. It just is a part of growing crops across the world, that this is a parasite that can find itself on, especially leafy greens and other produce, wherever we grow produce, especially in places near the equator. And so this is not uncommon. It thrives, Frank, in warmer temperatures. Warmer, humid temperatures is really critical ingredients. And we have a warming planet that's warmer and more humid for more parts of the year. So it's not surprising that summer is when we tend to see it. There can be anywhere from 200 to 300 reported cases in a given summer, a typical summer. And we, often we don't really talk about it. I don't remember talking about it, for example, in my public facing role for MSNBC, MS Now in 2025 or 2024. We are talking about it now. We can talk about those root drivers, why we're talking about it. But we're seeing case rates very clearly about 20x higher than what we would typically see in a routine summer. So is this something that we will see sometimes? Yes, no doubt. Do we see it at this frequency? Absolutely not. And I think it's important to recognize that this is an outlier.
So with a record-setting number of cases, I think the headline we just put up with the latest numbers look like 11,500 perhaps. Yep, there we go. 41 states. Man, that's widespread. how get us up to date on what we know about tracing and whether and this whole confusion that seems to center around Taylor Farms or Taylor Fresh Foods, and specifically their farms in Mexico. Our
Right.
We've heard things like, "Yep, we got it." Nope, we have a false positive. But
Yep.
we see Taylor announcing an apology from the FDA. We hear the FDA going, "No, we didn't apologize." What do you know that you could share with us?
I mean, first, I was having conversations with colleagues of mine in healthcare and public health, and it just I hate to say, I mean, just to be blunt, the incompetence and the lack of reassurance based on just those exchanges that we saw earlier this week should really, I felt for all of us in the American public that have to deal with this, because this is not normal to
Mm.
see that. Well, let's parse through that. In terms of tracing, just to give you a sense, typically we'll see Cyclospora uh, mini outbreaks in a few states across the country, up to about 300 detected cases in a given summer. So that's usually what's routine. Handful of hospitalizations. You just put it up on the full screen, 11,500 and counting. Uh, we are likely significantly undercounting, I suspect, how many cases there are of this condition, because the American public is not used to major outbreaks of uh, parasites that can cause this type of condition. A lot of people just assume it's a stomach bug, it will pass. They might see their primary care provider and be given a course of antibiotics for just an upset stomach. So public awareness, now we're solving for that because now people are hearing about this, but public awareness tends to be pretty low on this specific condition. So one, we're not probably capturing the full extent of cases. So 11,500 is the minimum. That's the benchmark threshold. It's probably a lot higher. 41 states, again, we typically see 2 to 3 states, Frank, where we might have these mini outbreaks in a given summer. We're seeing 41 states. So probably safe bet that it's in every single state in the United States, even if it hasn't been formally detected. So this is a major consideration here. We have the HHS secretary yesterday saying that this is under control. It's not that big of a deal. There is nothing worse than you can do than to say it's not that bad when you have an evolving public health, in this case, crisis that I think could become maybe not emergency level, but something that is clearly impacting the entire country and is causing worry. So this is somewhere between a full-blown crisis and a national emergency. I'd say it's not quite at the national emergency level, but it's a crisis, and he is trying to minimize it, as he typically does.
He
Not
did it
help.
in COVID. Look, Trump did, as you well know, he tried to minimize. It'll go away in a couple of weeks, right?
That's right. Well, and what's to bring it back to tracing and the extent of this condition,
Yes.
people need to be made aware from the highest podiums in the land of what's happening, what to be on the lookout for, what symptoms to worry about, when to seek medical care. Ideally, that comes from Kennedy himself or one of his top doctors. I hesitate to call most of the doctors around him actual doctors, because they've given up a lot of their oaths to our profession a long time ago. But I would love to see one of them step up into the void and say, these are the things that you should be worried about, and to leverage their platform for good. They're not doing that. They're minimizing it, which unfortunately is what we're having to deal with. So it falls on media organizations and those of us on the outside to fill the gap. So this is a crisis at minimum. He is minimizing it. And then you had what happened on Monday, Sunday into Monday, Frank, as you referenced, as I think a vivid example. And really, I don't know how anybody, regardless of their political beliefs, couldn't look at what happened on Monday and say, this is not worthy of the offices and the institutions that these people are serving. You have the FDA, and I'm going to support the FDA and the CDC here, because they have professionals, just like in your line of work, Frank. There's a lot of people at the FBI that are career staff doing their job, regardless of the insanity of the political appointees.
Yeah, they're trying.
In this case, CDC and FDA, just to back up my colleagues that are working there, There's career staff that have still stayed in the job. I know a lot of them. They are good people that are highly credentialed, that are working under extraordinarily difficult circumstances. They're demoralized. They worry actually that in some cases them staying on is going to harm their future job opportunities, which it won't, because I think a lot of us recognize what they're doing, which is a service to the country, even more so now. But they are doing the contact tracing, and CDC did it with FDA. FDA food experts, thankfully some are still there, are the ones that are working with Yum Brands, which is the overarching corporate conglomerate overseeing Taco, or that owns Taco Bell. And luckily, these entities working with the CDC and FDA and career staff were able to say, well, it looks pretty compelling based on contact tracing that that majority of people got sick at Taco Bell restaurants within the Midwest. These entities source their ingredients and have mapping of their ingredients and documentation of it very clearly. I mean, it is quite impressive how they contact trace, and they know where they source everything from lettuce to cheese to everything. And they were able to very clearly point out that the source is Taylor Farms, and it's perhaps specifically their operations in central Mexico, which, by the way, in 2013, Frank was also implicated in a Cyclospora outbreak. So this is not unusual. It's not uncommon.
Right.
It happens. The fact that the Taylor Farms CEO, so FDA issued a notification, the reasons of which are not clear. And so I think that's where there's some confusion, and we can speculate on why.
Yeah.
That there was a false positive test on a piece of lettuce somewhere in their supply chain, which, no surprise, false positives can happen all the time. You pick a random piece of lettuce, you test it, may or may not test positive, because we're not saying every lettuce head within their supply chain is infected with this parasite. So not surprising.
But that, correct me if I'm wrong, that pronouncement of false positive came after Taylor Farms officials met at the White House with FDA officials.
That's my understanding of the time series.
Yeah, mine too.
I've been following along the reporting, and I know a lot of people are connecting the dots. My understanding is the Taylor Farms CEO is a donor to this president. There might have been some.
Yeah, we're up to $2 million in Taylor Farms family, and a company can't directly contribute,
Right.
But they can certainly do it through their PAC and lobbying efforts and family and officials, and we're up to about $2 million at least.
Interesting. Well, and so I think it's curious minds and anybody that's able to just sort of piece together dots in their own way.
Yeah.
Look at the series of events and say, well, why is this happening? So that meeting happens, money is exchanged, and that's happening in the background. But what's unusual on the scientific and public health side is the FDA having to issue a notification that a false positive test may have occurred. Typically, that isn't issued by the FDA, because we know that these things happen, that false positives happen all the time in food testing for different pathogens. This is not newsworthy stuff warranting a tweet or any sort of clarification, because, oh, by the way, all it does is then cause confusion in the public.
Yeah.
Because the question I got was, well, then is this not the source? And so then all of us said, well, of course not. False positives happen all the time. They have very compelling contact tracing. It all makes sense. It's all mapping accordingly.
Right.
Taylor Farms CEO then puts out what I thought was an absurd, over-the-top, dramatic, and inappropriate statement on social, saying, quote unquote, the FDA apologized to us, which was I'm not sure who's advising him. The idea that would look in any way support his cause. I mean, he's the CEO of the company. I understand what he's trying to do. But the idea that the tone of that message and the way he put that headline out there was going to reassure people or enhance his credibility, did the exact opposite, because who puts out a statement?
To be clear for our viewers, and tell me if I've got this right, false positive announcement or not, there was a positive that with regard to Taylor Farms.
There was a positive in the sense of a full contact tracing investigation has highlighted that they are the likely source of this outbreak.
And the recall remains in effect.
The recall remains in effect. The FDA put out that there was a false positive, which I think didn't help their cause.
No.
The Taylor Farms CEO then retweets the FDA statement saying the FDA apologized to us. I'm not sure if that actually happened. And then the FDA had to then retweet the Taylor Farms CEO and then make a comment saying that, to be clear, the contact tracing still points very strongly towards Taylor Farms as the culprit source for this outbreak. So they all look, unfortunately, amateurish. All they've done is confuse the public.
Right.
And they have harmed the FDA, sadly, in addition to the Taylor Farms CEO, who I do not know. Any credibility they've had has been deeply injured, if not entirely lost. But I mean,
it's the larger issue, is it not? That of the death by 1,000 cuts of our institutional credibility. You know, my old agency, for just one example, and now importantly, the CDC, the FDA, all losing credibility. It would be like kind of like the FBI making an announcement that, hey, a bomb did not go off at this location at 10 a.m. A bomb did go off at 9 a.m., however. So it's not like, a bomb went off.
Yeah. Right. I know, it's 100%. I mean, the fact that clearly they were compelled to do something that I think the FDA typically would not have done, because they recognized and they immediately clarified that in spite of a false positive, everything remains true. So I guarantee you there was probably some degree of being compelled to have to put that statement out there. Yeah, and they knew, because they're smart people there, that they knew that this was going to cause blowback and it was going to cause confusion, but they probably didn't have a choice.
Okay. And is it accurate to say that the CDC had something called FoodNet that monitored foodborne illness, parasites, but to your knowledge, was it cut down from like monitoring 8 things to 2 things, and Cyclospora was one of the ones that was cut out?
That's exactly right, Frank. In July 1st of 2025, as part of DOGE activities, and blessed by the HHS Secretary, RFK Jr., FoodNet, which is essentially our smoke detector system for foodborne illnesses for the United States. It's a partnership between, this is just for your audience, partnership between the USDA, FDA, CDC, and 10 large state departments of health. So basically what they're doing is they're assessing the food supply, sampling different pieces of agriculture, different supply chains for our produce across these 10 states. They can't do it across the country, but they do it geographically in a diverse way to basically do strategic sampling of our food supply to make sure that we're not missing anything. It covers about 15% of the US population. And they sampled for 8 pathogens that are known to cause human illness, if not detected and removed from our food supply, to include, as you pointed out, prior to July 1st of 2025, Cyclospora included other very serious illnesses or pathogens like Campylobacter that can cause a devastating diarrheal illness. And there are 6 others that have been deprecated. Now we only test for Salmonella and a version of E. coli. Important that those remain, but the other 6 have gone away. And I saw Kennedy trying to explain away these cuts and again minimize it and say that states still continue to do this testing, which is not true. States relied heavily on federal support, especially during the pandemic. And now that all that pandemic-related support has gone away, and now we've further reduced healthcare budgets at the local and state level. So this idea that states and local officials are doing any version of this testing for all 8 pathogens and are adequately staffed is nonsense. They're not, hence the July 1st policy.
Well, I was going to ask you about whether the states can step up or not. It seems like the state of Michigan in this outbreak has done some really good work. But is it your sense that the cuts there to FoodNet, was there any sense to it, or was it just kind of random? Let's cut some things.
I can imagine. I'm trying to put myself in their shoes. And I'm not. I'd say, given the haphazard nature of all cuts in the medical field, whether it's NIH budgets that make no sense, have generational impacts, a CDC entire divisions are gone away. I would say that there's probably a USAID is gone, even though the benefits far outweigh any related costs. To me, this feels ideological more so than having any sort of evidence-based grounding on it. Salmonella and E. coli do cause arguably the most amount of human illness year over year. So if they're sort of rank ordering based on priors, perhaps that went into the decision making. Let's keep these two. Let's do away with the other six. But now they're ruining the consequences here. Of well, actually, if you don't sense and detect Cyclospora, look what happens. And so, I think we're going to see, unfortunately, the impacts of hollowing out all of our public health agencies, because typically public health operates in the background, just like the FBI does on security issues.
Yeah.
It's most successful when you don't see it. And now we're going to start seeing it.
All right. So knowing that, armed with that lovely information, what should we be doing in our private lives, our family, ourselves? What are you practicing now with regard to this outbreak?
Sure.
And should we eat salad from where, and bag salad or not, washing or not? Tell us what you're recommending to your friends and family.
Sure. What I would say is safest. And so if you want to be ultra safe, and I would say, and this really applies to anybody who's over 65, might have an underlying medical condition for which they're immunocompromised because they take a medication, or that are functionally immunocompromised. We use that term to say anybody, say, on dialysis or under poorly controlled diabetes. We think their immune system is a little weaker than it would otherwise be. They're functionally immunocompromised, or if they're taking medication. So if that's your situation, or if you have a loved one in that situation, want to make sure that you do these things to your produce at home in your refrigerator. One, absolutely make sure that you are washing any produce for at least 30 seconds. Sometimes I think, we tend to be lax on some of those habits and just pop something into our mouth as we're cooking. Don't do that. Make sure you're washing everything for at least 30 seconds. If you want to take an extra step, something that you can't peel on the fruit side, if you have a sort of a produce scrubber, that nothing, scrubbing and washing does not eliminate Cyclospora. It reduces the parasite burden. So if you have a leafy green in front of you and it's infected with Cyclospora, washing will not remove it entirely. So just let's be clear on that, nor will scrubbing, but it reduces it. If you can peel your fruit, especially those that are medically higher risk. And Frank, I would say right now, since we had all this nonsense on Monday between Taylor Farms and the FDA, and hard to feel like we can trust anybody right now at the federal level on healthcare issues, especially. I would steam your spinach and or cook your leafy greens in some way. I know that's harder to do with lettuce, but say with spinach, we steam our spinach. We typically like to steam our spinach. But if that's something that folks would be willing to do, that's an extra step you can take. Yeah. If you're not a steamed spinach person, definitely avoid bagged lettuce from any brand, in my opinion, right now, at least until we have greater clarity and things calm down.
Right.
I think fresh heads of lettuce are much better than bagged lettuce. So if you want lettuce, go for a fresh head of lettuce, wash it thoroughly. You should be fine. Yeah. But again, if you're medically high risk and you want that extra precaution, cook your leafy greens. And I think you're going to make sure that you're foolproof. And those are the steps I would take. I think salads are fine to eat, but I would avoid bagged lettuce that has just sat there potentially for a week with things that you might not be able to guard against.
Yeah, really good practical advice. And I think, sadly, the first time I've heard about the age distinction, 65 and over, and the immunocompromised distinction, which is a very significant percentage of our population, is it not? You have any idea, percentage-wise, how many people have some form of immunocompromised condition?
Gosh, I mean, the numbers are quite alarming. If you really,
a lot.
I think it depends on how you define it, Frank. But if it's taking a medication and it's directly suppressing my immune system because I have rheumatoid arthritis, or I have inflammatory bowel disease, or something in between, or I have a type of cancer. That's probably in the 10 to 15% range of the population. But if you add on those on dialysis that are functionally immunocompromised, immune system just doesn't work as well with severe underlying condition, or poorly controlled diabetes. I mean, you're talking about maybe an additional 20% of the population. So I'd say at least 1 in 3, maybe up to 40%, you could argue. But then, so there's a lot of baked in medical fragility.
what should we be looking for then in terms of symptoms? And how long does it take for symptoms to manifest? I've heard that some of the difficulty and challenges in tracking this is people might have been on a business trip to Michigan and had a Taco Bell meal or some other meal, returned home a couple of weeks later to Arizona, and now they're sick. And so, what are we looking for? What are the symptoms, and when should we go to the doctor?
Sure. You again, beautiful tee up here. You're right. The challenge with this, coupled with the lack of public awareness and minimization, is that the symptoms, just like with when it comes to respiratory infections, everything sort of mimics each other. And so, how do you distinguish between one virus and another if you have body chills and a cough and a cold? It's really hard. In this case, it's the GI version of it. It's unpleasant and it can cause GI upset, Cyclospora, but I think a lot of people might say, well, occasionally, based on what I eat or if I'm traveling, maybe that's, they come to expect that occasionally. And so there's mimicking of symptoms that does not necessarily point to Cyclospora. Here's where it's really critical. The incubation period is 2 to 14 days, which is hard to contact trace because, well, gosh, I could have eaten something 10 days ago, you're telling me, and then that's what's causing my symptoms now, almost 2 weeks later. That's really hard. So one, think expansively if you are developing basically watery stools, bloating that isn't going away over a 48-hour period. Everybody's using the term explosive. Take for that what you will. But if it's basically you are miserable and you have GI upset and it's not going away within a 24 to 48-hour period, and you should know one thing I would urge people to make sure that they check in on is their sense of their bodies. I'm sure everybody's experienced GI upset at some point in their life. And when it resolves on its own and the time course of it, and when it doesn't, you need to seek help. In this case, within 48 hours, if things are not improving by their own, and let's say you're not able to actually keep food or water down because you're losing it through GI upset, if you feel like you're getting dehydrated and it's been at least 48 hours, I encourage anybody with that set of symptoms, regardless of your travel history, but especially if you have, say, a compelling travel history or Taco Bell in your recent past, to go see your medical provider. So that's anybody, Frank, just to be clear. 48 hours plus, you feel like you're getting dehydrated, your heart rate's going up, you just feel like you're constantly drinking fluids and you're losing it the other way. And maybe you have a compelling travel history, but even if you don't, go see it, because we're making the assumption that this is everywhere, not just in 40 states, not just in those that experience Taco Bell. I would just make that blanket assumption.
Sure.
If you're medically higher risk, this ups the ante even further. Same rules apply. 48 hours, it's not going away. You're feeling dehydrated. One way to know perhaps that you're dehydrated is if you have some sort of device that may monitor your heart rate. I often tell people, a lot of people wear something on their wrist or their finger. If your resting heart rate has steadily increased, say over the last few days, so maybe you're in the 60s or 70s at baseline, maybe now that's climbing up in the high 70s or 80s, heart rates tend to increase when there's dehydration. And so check in with your body and the tools that you may have at your bedside. But then important to go to a provider, Frank, because early testing allows for early treatment with antibiotics. We have great antibiotics that can treat this. Just don't assume that you can sort of toughen your way through this, because this can be quite severe.
Really good advice. And if there's any bright spot here, you're telling us, you're mentioning antibiotics, which means it's bacterial, not viral. So there is, you can treat this.
That's right.
Yeah, great news. Let's go to the larger topic of what's happening in our public health with CDC, with RFK Jr. at the helm. There was a headline, I think it was in Atlantic magazine's a couple of months ago. The front cover said something like, the most important scientist in America. And it had a picture of RFK Jr. And of course, he's not a scientist. He's not. And so what we're dealing with here is things like childhood vaccine scheduling, right? And states kind of going off on their own. And the Air Force Base, and do I know correctly that you are or were a major in the Air Force Reserves? Do I have that right?
I was 14 years Air Force, and I just actually completed my service earlier this year. So 14 years as a CCAT, critical carrier transport doc.
Well, thank you for that, and congrats on moving on from that. And of course, we got major media coverage out of San Antonio and the Air Force Base there when Pete Hegseth lifted the mandatory flu shot protocols, and everybody got sick. Let's tackle one of these at a time. How about pediatrics and childhood vaccines? What do we know? Where are we? And there's a headline that we can throw up right now. I saw it this morning that we're now at here's another record. America first. U.S. measles cases hit 35-year record, and the year's not over yet. What's going on with measles?
I mean, it's unbelievable. My wife's a pediatrician. My mom was a neonatologist, and we're very close with the American Academy of Pediatrics in terms of partnerships. And so I would say that it is impossible to ignore that, whether it's cutting FoodNet and now we're seeing Cyclospora, or whether it's under messaging or frankly, completely counter messaging the importance of measles vaccines and what we've seen since March of 2025 with this devastating outbreak of measles. This, what they're doing, RFK and his deputies, is having immediate impacts on childhood livelihoods. Children are dying, and people are miserable because of this Cyclospora outbreak. And I mean, it is life-threatening if it's not treated. But I mean, we're seeing this across the realm in pediatric vaccines. He's not done. He is basically trying to change the mechanisms, the committees, the personnel in these committees, Frank, that do and do not approve vaccine recommendations, ultimately up to the CDC director. He is attacking and revising the frameworks by which these edicts and these recommendations get passed. So he knows what he's doing. He knows that he can't just ram through his ideology up front. So he's changing now the personnel on all these committees to suit his ideology. And so who knows what's going to come down the pike. They're under messaging this now in the lead up to the midterms because they know it's unpopular. 86% of people in a recent poll by KFF, Kaiser Family Foundation, said that they trust their own personal physician when it comes to vaccine recommendations and other healthcare decisions. Less than 40% trust what's coming out of RFK Jr.'s podium. And so that says it right there, clear. And that was a bipartisan, geographically diverse survey. Others say something similar. People do not subscribe to what he's doing on childhood vaccines, and they're seeing what's happening with measles. My worry is that this is only going to get worse before it gets better. And I do hope that we have some way, just like they do in law, there's a way to hold to account bad behavior and people that don't stay true to the integrity of their profession. Yeah. You can disbar people. Yeah. I wish we could start to de-license physicians that give RFK Jr. cover, that promote this type of nonsense.
Is that? Let me ask you about that, because that's a great point. And we've seen, from Rudy Giuliani on down, we've seen lawyers disbarred for their nonsense with Trump. Is it harder to do for a physician?
It is not right now. There is not a platform right now, Frank, where we can do this in any way. It's sort of at the state level, different boards of medicine can or cannot de-license, but it's very state-based. There is no overarching body like the American Medical Association or some other entity that you would think would step in and say enough's enough. Sure. If people are engaging in this type of behavior, they are no longer be allowed to practice medicine. Because, the other piece here too is it's very easy to fool people on social media that somebody with an MD behind their name or Dr. So-and-so knows what they're talking about, or that they're credible and respected. It's very easy to fool people.
Yeah. I wonder though, if civil lawsuits, if enough children die, let's say, I don't know, my understanding is Florida has lifted their mandatory school requirements for inoculations. If that's true and enough kids die and there's a civil action against the state leaders and maybe the chief medical officer for the state, it seems to me that would get their attention and maybe change behavior. Yes? No?
I mean, Governor DeSantis, just since you brought up Florida, has protected the quote unquote Surgeon General of the state, which I mean, and this Joe Ladapo, you may know the name, not a practicing physician,
Oh,
deeply not welcome in, I'd say 99.9% of medical communities across the country. It's a very small cohort of people that back him up.
yeah,
Uh, but he has the blessings and the support of the governor who's ideologically aligned with him, and that for whatever reason is protecting him versus any sort of medical establishment or medical body
right.
that could intervene. And so it's
Right.
just about power structures and who can and cannot intervene.
In the remaining time we've got, I want to cover, people often say, hey, this is interesting. Frank is the national security guy, and now we're talking about diarrhea. I want to bring it home to what I am passionate about, which is national security. So let's talk about the
Sure.
vulnerabilities as a nation we have. And one of the kind of blatant examples is that Air Force Base in San Antonio, and so many people, perhaps hundreds, getting the flu.
Yeah.
And then why don't we throw in Pete Hegseth, Secretary of Defense or War, mandating testosterone testing for the military age 30 and over. Tell us
Sure.
what's going on in the military.
Sure. I mean, so a physician for 14 years in the military and served as a critical care transport doc, but saw the whole thing. I would say 90% of the time, when you're not training for your actual deployed duties, you're focused on medical readiness. Whether it's PT, whether it's making sure you get all your testing and fit training in. So much of being in the military is medical readiness and just overall readiness, but that's key input. The idea that he has essentially embraced culture war medicine as a key framework of how he's going to lead the Department of Defense or the War Department, as he's reframed it. And I can tell you very clearly, I mean, with individuals that are still under his chain of command, I'm thankful to no longer be within his chain of command, so I can speak more freely. But I know that there is, I mean, it's many of these people that are still under his chain of command think is comical stupidity is the word that I keep hearing. And this idea that testosterone testing for everybody past a certain age is a requirement now, and that's somehow going to help with readiness. Frank, we're focused on readiness. Is just it's marketing. It's not actually based in science. There are certain people that should get tested for testosterone. Fully embrace that. If they're chronic fatigue, maybe they have a mood disorder. Maybe they're losing muscle mass. They don't know why. There's a very legitimate reasons to get testosterone screening, which is 2 morning screens on separate days to understand what might be happening. And if somebody has consistent symptoms, to make sure that they're treated properly. That's 100% medically valid. We all support that on the medical side, especially in the military. Really important. But the idea that you're going to test everybody, that you're going to test, that this is broad screening, regardless of symptom profile, makes no sense. Some people think that this is the worst of gender affirming care. That's their opinion. There is no evidence-based guideline suggesting this. And do I think this is going to help with readiness? No, because we already were screening people and testing them and treating them if they have low testosterone and symptoms consistent with that. That was already part of an offering for a troop that might be feeling consistent symptoms. This is not offering anything valuable or new. It's cultural war medicine.
Yeah.
And to your other point on flu vaccines, again, people that are serious, the career staff, quote unquote, the 20-year plus crowd that are still in there, thought it was comical incompetence to remove the flu vaccine as a requirement for troops, because this is about deployability, a 48-hour call up, is a unit ready to go. In Lackland, we saw it, just like now we're seeing with Cyclospora, we're seeing with measles, we're seeing with the EPA and that smoke everywhere. I mean, the idea that just within even a few months we would see the impacts of these policy decisions I was shocked to see it so quickly. But 20 to 30% of that unit was rendered not deployable because they were sick with the flu.
Yeah.
This is
if we want to talk about readiness, there's your readiness. Everybody's down with the flu.
This, none of it is culture war. It's not ideological. It's not do you not believe in vaccination? Is do we have a unit that's ready to go on a 48-hour call up? And whether people like it or not, flu vaccines help. It's not perfect, but it prevents serious illness still very strongly. It's very effective in that. And it's important as a part of our readiness. And so this is directly impacting our national security and your line of work, direct impact. And he's made a mockery of the Defense Health Agency and some of these policies because serious people that are in charge with actually executing these policies think this is comical stupidity.
Yeah, and of course I get it, but it's comical until people start dying, and or our troops are not ready to deploy because there's wide scale illness. And
That's right.
we just threw up a headline that said, yeah, Hexa did reverse himself. He listened, I guess, or he realized the readiness issue he had created. So there's some glimmer of hope, perhaps. Are you following? And I know you've got to have your hand on everything that's developing in the public health arena, but in the last seemingly 48 hours, we see reports that there is a deadly, let me get this right, a deadly bacteria, at least in Cheyenne, Wyoming, that's been linked in the town water supply, that's linked to a AI data center. And the bacteria is, here we go, Cupria vitis gilardia, something like that. Have you seen this yet?
I'm just making sure I have the a white column. Oh yeah. Yep. I'm now reading about it. I didn't actually see that pop up, but now I'm.
Yeah, and the municipality there in Cheyenne has actually said, "Holy cow, timeout! This is water. This may not be water they use for drinking, but they use it citywide for irrigation." And do you know anything about this bacteria specifically? Is it, as the headlines are saying, "quote unquote" deadly? There's a headline right there. And are we going to? Is there anybody home at CDC to go, "Holy cow, we're having a problem with AI data centers now"?
It is familiar as a bacteria. It's rare as a source of infections in humans, but when it's present in the water supply, it's something that is naturally found in the environment, especially in soil. But when it has the ability to infect human beings, and if it's in the water supply now at scale, because perhaps of a data center related issue, what I worry about most, to harken back to Cyclospora, something that is also commonly found in the environment, is this is something that can cause a significant infection in those that are older and those that are immunocompromised for whatever reason. And so could it be serious? 100%. Do we hear about this a lot? No, because it tends to be rarer, not nearly as common, but it is naturally occurring, Frank. If soil is being disrupted because perhaps there's a data center that's being built and that soil is being uprooted and bacteria is being dislodged and now entering a water supply, and more people are being exposed, because typically this lives in soil, less in the water supply. So if we're now seeing translocation of a dangerous potential bacteria from soil to water because of data center infrastructure, that puts more people at risk. And the people that are greatest at risk are those that are older and immunocompromised, and can cause a life-threatening gastrointestinal illness in those people.
Yeah, and there's a kind of a double concern with this, because we've already covered all of the gaps and weaknesses at CDC for monitoring, et cetera. But let's add in now that the Trump administration is joined at the hip with the oligarchs, the broligarchs, and high tech and Meta. And so if this is their data center and Trump is pushing AI like never before, they would theoretically be less prone to come out and go, "Hey, we've got a problem with data centers and bacteria."
My hope is, I see the concern, and my hope is that they're doing the right things here, because this can cause multi-organ dysfunction, sepsis, pneumonia. I mean, this really can cause serious impacts here beyond just the gut, and so they'd be well advised to take this seriously. My hope is that this new CDC director that I suspect will get confirmed, Dr. Erica Schwartz, who I respect as somebody that is nonpartisan, that just tries to do the right thing, I hope that she'll be allowed to do her job. My biggest concern is somebody in that position in this administration going to be allowed to speak independently? To your point, if the interests of the public and public health or contradict perhaps economic relationships with a tech oligarch and data center building, who's going to win out? And I think we saw with Taylor Farms and FDA how that went. Are we going to have something similar? Because really what we need right now, Frank, more than anything else, is clear, crisp communication, and ideally from the highest podiums in the land, because there's only so much you can do on the media side or from a medical institution. That's right. To fill the void. You need the highest podiums in the land to really do the job that they are supposed to do.
Well, listen, that's a great way to kind of ease out of this. In the absence of those people speaking truthfully and accurately at the highest point in the land, we reach out to folks like you to help fill the gap. And you have today. Please keep up the good work. Keep us informed. And we'd love to have you back as circumstances permit.
Thanks, Frank. I'm delighted to be back. Thank you for the trust.
Thank you. Stay well. Bye now. Yes. All right, folks, that was Dr. Vin Gupta. Boy, we could have gone probably for another hour with all that's going on. And he pulls no punches. He says it as it is. And I learned just in preparing for his intro that he had that Air Force experience, which is right on point for some of the things we're talking about and national security concerns. So if you aren't following Dr. Vin Gupta, please do so on social media. Catch him also on MS Now as he contributes there. We need more true medical professionals like him. I'll see you on Friday for Frank Friday. And that's at 5 p.m. Eastern on Fridays. I hope you got something out of this. I did. The takeaways for what to do at home, really practical stuff. The washing of fruit, good news, bad news, and produce, it's not going to all go away, but some really good advice about peeling fruit that can be peeled, steaming, cooking your produce, great advice. And look, if you've got folks, if you or you have folks in your family who are 65 and over and or immunocompromised, which is a whole bunch of people, you should not delay in getting to the doctor if you are symptomatic. I'll see you on Friday. Thanks for joining us. Take care.